welcome to part one of our lecture on chapter 4, Multicultural Considerations in Assessment. And to start our conversation on multicultural assessment, I want to begin by defining multicultural assessment in the context of counseling. Because really, multicultural assessment is the purpose by which we as counselors consider how multiple cultural variables influence how clients' concerns are expressed, conceptualized, and treated in counseling. So, if you step away from this definition, what this is really saying is that we as counselors are responsible for looking at all of the different aspects of our client's identity, their culture, and what makes them them, and how that changes both how they describe what's going on for them, how we diagnose them, and what treatments we provide to them. And it's important for counselors to build multicultural competence because that is an integral part of counseling and the assessment practices is this multicultural competence in being able to build those connections. Because if you're able to see a client for who they are, all pieces of their identity and culture included, then you're going to have a better working relationship and rapport with your client. So not only will your counseling improve, but also your assessment will improve. And unfortunately, the multicultural assessment and multicultural competence is actually noted by some as being the single most omitted step in providing culturally relevant services. And what that means is that a lot of counselors aren't going this extra step to look at the ways that cultural variables are playing into clients presenting concerns, how they're doing in treatment, and even how they're talking about things in session. So that's why we're spending an entire chapter talking about these things because it is vital to the work that we do as counselors. So, within the context of multicultural counseling, there is an agency called the Multicultural and Social Justice Counseling Competencies, which is guidelines for attending to 4 different developmental domains within the context of the power differential in counseling that oftentimes exists between the counselor and their particular client. And the 4 domains that are listed are counselor awareness, the counseling relationship, the client worldview, and counseling and advocacy interventions. And the developmental domains are depicted by concentric circles that build upon one another. So you start at the center with the counselor self-awareness, and outside of that you focus on the counselor relationship. Outside of that you include the client worldview, and the last circle of that concentric design is the counseling and advocacy interventions. And it is the responsibility of counselors to build awareness and knowledge and skills and action plans to facilitate these first 3 domains, so self-awareness, the counseling relationship, and client worldview. And for that 4th domain of counseling and advocacy interventions, counselors are to consider how those interventions can be fused across 6 levels to build multicultural counseling competency. And the 6 levels are intrapersonal, so within person, interpersonal, so our interactions with people, institutional, community, public policy, and international. So again, with these domains, it is our responsibility as counselors to build awareness, knowledge, skills, and action plans to facilitate counselor awareness, the counseling relationship, and client worldview. And in terms of counseling and advocacy interventions, counselors need to consider how these interventions can be fused across all domains of counseling competency. One of the things that's really interesting about our book is that it provides a list of questions that we as counselors can reflect upon to build our multicultural competency in the assessment process. And I just grabbed a couple of these examples because they actually have quite a few questions that you can reflect on that fall into each of the developmental domains proposed by the multicultural and social justice counseling competencies. So here's a sample of them from each. One of the questions that you can reflect on to build self-awareness can be, what attitudes and beliefs and knowledge do I hold about my privilege and marginalized statuses? In the context of the therapeutic alliance or the therapeutic relationship, what actions can I take to initiate cross cultural conversations with clients to foster the counseling relationship? In the context of client worldview, we can ask ourselves, what culturally responsive skills should I cultivate to foster an affirmative assessment experience for clients? And in terms of advocacy, how can I intervene with and on behalf of clients at the interpersonal, intrapersonal, institutional, community, public policy, and international levels? So, again, these are just examples of some of the questions that you can reflect on while thinking about the work that you're doing and building your multicultural competency with your clients. And it's important for us within the assessment and treatment of all of our clients, for us as counselors to display both a sensitivity to be aware of cultural variables that affect the assessment and our own competence, but to also translate this awareness into effective assessment, which isn't always easy because most assessment tools that we have, if not all of them, have some cultural bias that's associated with them. And bias can occur because of inappropriate norms that prevent the accurate comparison of a diverse client's scores to the standardization group. It can be limited relevance of some test items or varying meanings of test items, especially if they're very particular to cultural groups, and sometimes even different cultural attitudes, such as test motivation and familiarity with test questions, can impact the administration and interpretation processes that come into assessment. So, there are two terms that come to mind in the context of how we as counselors need to work on minimizing that bias that shows up in assessments. And the first of those is fairness. And fairness in this context is defined as efforts towards creating equitable assessment conditions and experiences for clients that are free from bias. On the other hand, bias is defined as an inaccurate score or test result that impact the way these findings are used with various cultural groups. So this could mean artificially giving someone a higher or lower score based on their identity for or their cultural group and identity with that cultural group. And we talk about these things in the context of assessment because there are very few assessments that have been comprehensively vetted for culturally diverse clientele. And that means that we have biased findings that are going to yield ineffective and likely negative treatment outcomes for our clients. So, when we're talking about this in the context of assessment, that means that we have tests that have been normed on most often white populations. And a lot of times it is around young adult age and typically pretty educated individuals. And that's who our tests have been normed on. And if we do not have assessments that have been vetted for anyone who identifies outside of that identity, we have to take into consideration how this is going to bias our findings and also how it's going to impact the treatment outcomes for our clients. Because cultural bias in assessment has been associated with things like misdiagnosis, underdiagnosis, and overdiagnosis, which can then lead to improper screening for different diagnoses, improper placement, improper treatment plans, and that's just to name a few. There are so many areas of our work that are affected by assessment, and if these assessments are not culturally vetted, then we are getting a biased look at how we can best help our clients. There is an agency called the Standards for Education and Psychological Testing, which we've already identified in Chapter 3, but they have come out and they have identified fairness in 4 different ways. And they say that the first way that we can define fairness is the absence of bias. With an absence of bias, a construct being measured by a test is interpreted free from factors irrelevant to that construct. So that means if you're the counselor who's using this assessment, you're using an assessment that's not measuring any extraneous factors. You have made sure that all clients are interpreting the question with the same meaning, regardless of their group identification and group membership. And you're making sure that your testing conditions are standardized for all people. That's how we create a test that is fair in terms of the absence of bias. The second dimension of fairness is equitable treatment of all test takers. And this means that fairness is avoiding improper use of assessments independent of their actual construction. So you are using tests for the reason that they were created. You are using them in the context for which they were normed, and you are using them for the reason that they were made. You're not using them for high stakes placement or determining if someone needs to be stepped up or stepped down in care improperly. The third category of fairness is irrelevance of group membership for individuals who are on equal standing for a particular test construct. And of the four definitions of fairness proposed, this is the one that actually receives the most controversy. Because a lot of times in history, psychologists would say that individuals scored differently because they had different abilities. And they eventually made that claim that if you have different abilities, it is an innate difference due to your group membership. And what we found today is that there are still differences in performance on different assessments based on group membership, but it's not due to innate differences in these groups. Rather, a lot of times those differences are systematic and structural. So, lack of access to materials or not being taught the information. So, when we talk about fairness in this definition, we really have to assess that if a test in its construction and implementation is fair, then as counselors, we should examine what factors may be causing any group differences and address those factors when assessment data are reported. So if we're seeing that a test has been constructed fairly and it's implemented fairly because the first two definitions have been met in fairness, and we're still seeing that difference in scores based on group membership, then most likely as counselors, that is a call to action for us to look at what other things might be causing this difference outside of identity. And the fourth definition of fairness, identified again by the Standards for Educational and Psychological Testing, is an equal opportunity among test takers to learn a construct. And that means that an assessment should always be the result of what is taught. So everyone should have equal opportunity to learn the material before they have been tested on it so that they have an equal opportunity to perform to the best of their abilities. And we aren't seeing differences in results based on access to material. And again, these standards for educational and psychological testing goes beyond this definition of fairness, and they actually break down our definition of bias in two separate ways. And they report that bias can be score differences as a result of the explicit test content. So, meaning that we can have bias in the actual content that is included in our test, and the access to that content can be biased. And we can have bias in score differences as a result of various response processes that are not intended by the assessment. And this particular type of bias is called a response set bias. And what that means is that the people who were constructing the assessment weren't intending for it to be biased, but based on the results of it and the way that the answers have been interpreted by clients based on group membership, bias has been identified. So this is going to conclude our first part of the lecture on Chapter 4. We will join in next for the second part in the next lecture.